I think the first thing a practice needs to do before they even think about talking to a payer about value-based contracting, and let's make sure we're clear here, we're talking about a practice entering into a special contract that's going to be a value-based participation by the practice with the payer. And this is not about drugs value-based contracting, but really the practices. So you need to start asking yourself several questions first before you really consider doing it. The first thing you need to look at is, do I have an infrastructure in place within my practice that would be able to support a value-based contract? And I want to be clear on that. Value-based contracts and value-based alternative payment models really are systems that are going to reimburse you for the delivery of some type of care, but they are not a care delivery system. So that's your responsibility as a practice to make sure you have a care delivery system in place that'll actually make a value-based contract work favorably for your patients, for you, and the payer. So some of the things you need to talk about is, have I adopted some of the principles of an oncology medical home that are going to be required to make a value-based contract successful? So I think that's the first thing you really need to look at, what you've developed in your practice, and then are there gaps that you're going to have to fill before you get into it. One of the things you need to really be very careful about looking at yourself is, are you able to collect data to be able to support your activity in a value-based contract, and more importantly, analyze it and do something about it? And when you begin to get involved with value-based contracting, data becomes a key issue in terms of your performance, and you have to be able to acquire that data properly in a timely fashion and then analyze it. I think what we've seen with some of this oncology care model, which is the CMS product, is the amount of data coming out of CMS to the practice is enormous, and handling the data in a proper way has been a real challenge for them. The other thing you need to consider in a contract is, what type of benefit or risk are you willing to take on in a value-based system? And there's all kinds of different levels, from just a shared savings or a pay for performance up to a two-sided risk thing where you actually put yourself at risk for not reaching the requirements of the contract. And you have to be very careful whether you're able to actually accept that risk, and more importantly, model ahead of time what it would look like for your practice before you get into that contracting. Another aspect I believe you need to look at is, have you put in place a proper decision support system and pathway system within your practice that will allow you to have all your providers come together with a commonality of care, a standardization of care that you can then manage in one of these new programs. And that also includes putting in place some type of a triage program for your patients that will minimize their utilization of emergency room in hospitals. Again, if you haven't put those things in place, you shouldn't be really thinking strongly about this. And finally, one other thing is, have you really looked at your formulary requirements of your practice? Are there ways you can substitute less expensive drugs for more expensive drugs? Do you have a pharmacist that has the ability to override a physician when they're out of compliance on that? So those are all the aspects I think you first have to look at before you actually get into considering contracting.